Well, hello, I'm Dr. Rob Borer. I'm here at Borer Family Chiropractic with a patient who's been a member of our practice for quite some time, Lisa. So welcome.
Thank you.
And we're here to talk a little bit about her experience in our office over a number of years. So Lisa, for my notes, I see that you started in 2011. So that's been 8 years.
Oh, 8 years.
8 years
Okay.
you've been under care. Yeah, I mean a little bit on and off, right? So
Right.
you weren't maybe under care every day of those that time period, but maybe we might want to start with kind of what brought you in originally and kind of what it was that brought you here first.
Right. So I had been suffering from migraines, typically once a month. You know, it would last just a day, and that was pretty manageable. And then eventually I started getting them more often. And I went to my primary care physician, and she prescribed medication, of course, which I was allergic to. So I was not able to take any of that. So I just kind of managed it through over-the-counter medications, you know, Excedrin, whatnot.
Got it.
So that went on for years. And eventually my migraines started becoming more frequent. And it got to the point where I had one it just wouldn't go away, and I couldn't turn my neck. So then it was dire straits. I needed something to happen, which is when I called you.
Okay, got it.
So that's what led me here.
Okay, got it. And then, so we started working together, started adjusting the spine, and then kind of how did things go after a little while? What was it like receiving care in this office? How did you respond, or how did you?
I mean, my migraines went away.
Okay.
I didn't get them once a month anymore. I just, I never got them until then. It was time to, I would start to get little headaches here and there, and I knew it was time to get an adjustment. So.
Right. Perfect.
Yeah.
Exactly. Right. And is that so? Fast forward to now. Now where you are now. Are migraines happening occasionally, rarely, infrequently, regularly, or what would you say now?
Oh, they're pretty infrequent.
Okay, got it. And is that kind of a clue that you might need
it's definitely. Yeah, I'm one of those patients that will wait until the very last minute. And I'm like, I've got to make an appointment. So, because, I don't have to come, it's like once every 6 months maybe, or even, I think it's more than that. I'm good.
It's infrequent.
So, yes.
So we've gotten you to the point where it's not kind of crisis care, it's more maintenance or management care. Where
exactly.
We're just kind of keeping things on track with the occasional adjustment.
Exactly.
And we don't need to meet nearly as frequently as we did in the beginning when we were just trying to get the problem first corrected and under control.
Right.
Yeah, exactly.
But even when we were meeting frequently, it was just for you to train my bones to do what they needed to be, that bone in my neck. Right. What they needed to do. So I wasn't getting migraines even at that point.
Exactly.
It was just,
wonderful. Yeah. Well, that's wonderful. Yeah.
I mean, it's like magic to me. It's amazing. The pain that I was in before.
Yeah.
Just, oh my gosh.
Right.
It's just ridiculous.
To have that resolved and corrected.
And I like to do things without medication, so if I can do something more natural, which this is totally,
no drugs, no surgery in this office. Perfect.
Yes.
Perfect. Good. Yeah. Well, this is the more natural route for trying to manage pain than maybe going to your medical doctor for medications.
Right.
Exactly. Well, wonderful. So that sounds fantastic as far as how you've improved. Is there anything else about what you saw from improvements that kind of surprised you, or maybe was unexpected, or other areas that improved as well?
Well, before I had come to you, and I remember telling you on the very first visit that my head just always felt so heavy. And normally you don't feel like the weight of your body, right? So my head just felt so heavy. I'm like, oh my gosh, I'm carrying this bowling ball around on my shoulders. And I don't feel that anymore. So that was nice. I always felt like my hips were kind of cockeyed.
Yeah, yeah.
And so I don't feel that. And I never would have thought that all of that, by one bone being out of place would affect so many different things.
Right.
So, that was nice too, not to have to feel that. And I can turn my head all the way around, which is also when I know I need to come in, because then I can only like turn to here instead of looking back. And it's like, oh, yeah, I have to come in.
Yeah, perfect. Makes perfect sense. Yeah, when things aren't lined up, they don't usually move as well or as smoothly or as gracefully. So that is a pretty good telltale sign that, time for an adjustment.
Yeah.
Well, fantastic. Is there anything else about our office or the doctors or, visiting here that we haven't covered that you wanted to highlight or talk about?
Well, I guess I would say it's always really easy to get into you. You guys are very accommodating whenever you need to make an appointment.
Mm-hmm.
There's usually not a lot of wait time when you get in. Things are really chill and relaxed, which is nice instead of, it's not a hectic setting. Okay. So I appreciate that. And I do like that, because I remember also when I came to you at first, you said that any chiropractic adjustments should never hurt. And so I really like that when you adjust my neck, I feel no pain whatsoever. So, that whenever I recommend you to other people, or if they're looking for a chiropractor, that's one of the things I mention to them.
Wow.
Whether they pick you or not, I always say, well, just make sure it should not hurt. Whatever they're doing to you, if it's hurting, they're probably not doing it correctly.
Right.
So,
Right. Well, wonderful. Know. Yeah, our approach is more on the gentle side than the aggressive side. Exactly right. So we use more accuracy than we do brute strength.
Right.
Very, very much so.
Yes.
So
I like when I'm not in pain coming to the chiropractor.
Right. So many people appreciate that.
After.
And, Right. Seek that, and so there are very gentle methods for chiropractic, which is what we perform in this office. Mm-hmm. So. Well, this has been great. So thank you very much for sharing your experience, sharing your thoughts on working with our office, and we very much appreciate you sharing these thoughts, and we very much appreciate the fact that we've been able to have the opportunity to help you. So anybody with that kind of pain is.
I appreciate you.
Yeah.
I do. I recommend you all the time for when people say, looking for chiropractors. I'm like, ooh, he's the go-to guy. Or your practice, because I've also seen your wife once.
Yes.
When you were unavailable. And
exactly. So there's two doctors, and sometimes people have a preference of gender for their doctor, and that's always an option here in this office as well. So.
Yeah.
Well, great. Well, thank you so much for your kind words.
Yeah, you're welcome.
Appreciate it. Yeah.